All right, so good evening. Thank you for coming to the office over here. And as a special guest for the viewers over, we have a former Olympian here on the bobsled on, what year was that again?
2014.
2014.
Yeah, it was in Sochi Olympic Winter Games.
Well, we're honored to have your presence over here.
Thank you.
Okay, so let's break everything all down. What can we do for you for today's visit?
I have injuries from before because I was in athletic team, I was in bobsled team, make a lot of pressure on my body. I have feet, my hips, my shoulder, my ankle, and biggest I think it's my lower back.
Biggest thing's the lower back. Okay,
yeah.
So let's break all things down because there's a lot of components.
It's a lot,
okay?
yeah.
So what's going on with the lower back right now?
Just feeling pressure. I didn't work out last year that often. I lose the tones of the muscles and my body is weaker. And I feel more pressure in my body. I need to warm up, I need to stretch, then I'm fine. But in that time when I wake up, it's very stiff, it's very painful and limited my move. But when I warm up, I'm getting better.
Okay. Any issues sitting or standing, walking?
Maybe if we do long walking, I feel the pressure. Sitting also, I need to little move every 30, 40 minutes, 1 hour.
Got it. You also mentioned you feel some tightness on the front.
On the front on the hips on the right side. Yes.
Okay. So we got sacrum involvement. Okay. So we got that. And also during consultation, you mentioned about what else is going on? We're dealing with the neck or the shoulder?
On the right shoulder, yes.
Shoulder.
Yes.
Okay.
I feel pressure when I do lap pull or some vertical moves.
So lap pull downs aggravates it. Any problems doing push-ups or
push-ups? Yes, with this.
Okay, but other than that, anything that aggravates the right shoulder?
Nothing. Yes.
Nothing. So you also mentioned during this consultation doing seated rows, no problems?
No problem with that.
What about bent rows? No problems?
No.
Nothing. What about shoulder press?
No.
No problems. So only lap pull downs?
Pull downs, yeah.
Interesting. So not bent rows, not... Okay, that is interesting. And you also mentioned about a certain angle, it's what aggravates it and what doesn't?
Yes, if I feel straight when I'm doing pull down, I feel this point here very pressure.
Right here?
Yes, and down deep, down.
Deep inside?
Yes, deep inside.
Okay.
And if a little change the angle, a little back, try to find a way, it's fine.
Oh. So... Tender right here?
Yeah.
Okay. What over here?
A little less.
A little less.
Yes, but that is yeah.
What about this spot right here?
Yeah.
That's tender?
I think, yeah.
Okay.
It's feeling like that.
Okay. So we got a levator scapulae. That muscle's kind of irritated over there. Okay. All right, so we got that component. And then let's break down the next part. So, what's going on with the right wrist?
Right wrist, I was doing boxing. And possibly I do something, and it's very painful when I'm doing push-ups, just with my hands. In this angle, it's painful. If I do with the bar, it's fine. This position is fine. This position is painful. It makes a lot of pressure. And I have also off elbow. I think everything is kind of connection.
Okay.
And
let's just real quick. Here. You can see already. See, I could extend this easily. It's locked.
Yeah.
You can only go 45-degree angle. Okay, well that's usually a lunate problem. Okay, your capitate's bulging out. See this big bulge over there? You feel that, right? So your capitate is bulging out. It's completely stuck. All right, so we're gonna set that poor fella back in place. Yeah, it's not happy. Scaphoid's moving fine. Lunate's stuck. Capitate's stuck. Trapezium, triquetrum, okay. Triquetrum is not bad. Hammate's a little bit stuck. Okay. Trapezium, trapezoid, nope, they're okay. Not too bad. First metacarpal's out. Radius is out. So what's going on with the gopher's elbow here?
I was doing pull-ups, and I was doing a lot in this big numbers, and it just one day I wake up and it was burning effect. But it was on the both hands, and I was thinking it will pass over time. Over time it's pass, but it's returning on this side.
Got it, because I feel it's very swollen on the medial side. So we'll take a look at what's going on. Okay, so Fill me in. What's going on with the feet?
Feet, I was doing like a long time, like athletic, it's very undisbalanced sport because everything you do in one side, running one side, jumping one side. And in my life, I put a lot of pressure on my right feet because I was doing long jump, hurdles and everything. And it's just, and I injured so much this feet and these calves here, and it's just cracking a lot, usually more in the evening when I lay down, crack 5 times. And then one crack, it's so like pressured and it's so strong, then you can hurt in like second bedroom.
Yeah, I already see you got hammer toes.
Hammer toes, yeah.
Yeah, they're pretty bad. You also have got bunions too. And if you stand up for me, please. You see, I already can see how your lateral arches are completely gone because it's bulging out on the outside. It shouldn't be doing that, and you still have these hammer toes curling in. So. And you have no arches.
Yeah.
Okay. So basically, yeah. Which are all,
my base is not good.
Right. All 3 arches are collapsed on the feet. So we'll take a look, see what's going on with everything. Okay. We're gonna start with visualization. We're gonna take a look. See now there's some couple body defense mechanisms your body's doing already. This is already swollen. It's inflamed. It's red over here. Muscle spasms already. I'm feeling on both sides. Okay, you got one big pitting edema at this level, so I'm marking that level over there. There's another one right over here. Tracing down. Okay, you got a lot of tight muscle spasms on the left side versus the right side, but it's still tight, both sides. Your body's trying to protect something, and you got a lot of swelling on here too. Right at this sacral segment over here. Fifth lumbar, there's a pitting edema here too. All right. So this instrument over here is going to scan for any potential abnormal heat abnormalities, and it should correlate with the swelling, edema, and the muscle spasms. Your body's trying to protect something. So this will help confirm what we find. You got a number right there. And you got a little chronic cold nerve right there. Okay, overlaying the data and also the history, what we're talking about. I'm gonna check, see how your hips are doing. Okay, this is locked. This is moving decently, but not too great. But this actually should be the problem, but it's not. Yeah, there's some fixation there. See, there's an open wedge on this 2S, and that will correlate with that right front hip problem. And yep, there's a swelling right there, and it's also a problem here too. How's that? Not too bad? Tender?
Not bad.
Okay. How about this one over here?
That's a little more, yeah.
That's your 5th lumbar. That is a definite candidate to adjust. Next one I'm seeing in the film is 6th dorsal, and yes indeedy, this is in trouble. 6th dorsal right here. Next one on the film I'm seeing a potential is that 3rd and 2nd dorsal. And that could help explain why there's some trouble doing the lat pull downs. Yeah, this 3rd dorsal is not happy. This is not pivoting too well. Next part is, now we check. Make sure the neural integrity from the brain is going down into the shoulder. See, now there's a huge knot. You feel that right there?
Yeah, I feel it, yeah.
Yeah. So, you feel that right there?
Yeah.
See, I can't tilt you too well, but it just fits cervical. So that's another candidate we need to address. Okay, go ahead, march. Yep. See, now we start to see the right hip is getting fixated as expected. Okay. All right, stop right there. Okay, go ahead, march. Okay, good. Okay, got it. So now we got a lot of things going on. Let's break down the first one, the low back problem. So whenever I hear about the right front hip problems, okay, then we're gonna think about sacral segment. Okay, that's a common referral pattern. And I see here in the lateral, it's got wide open, and we confirm it on you, okay, that's one potential problem. Now, based on this x-ray also in terms of the foundation, right, there are some interesting things that it should be, correlating with the data I'm finding on the exam, and it's not. So whenever the data whenever it doesn't line up ideally, then we're going to take a look at what other external factors that may throw things off. A sacral segment can definitely do that, because when I take a look at your foundation over here, okay, this pelvis, it's slightly tilting this way. But the line over here, I'm expecting it should go to the right, but it went to the left. But what's interesting is that, you see this? It curves. It's supposed to be a straight, pure line, but it curves instead. A sacral segment also does that as well. So in other words, your body is trying to make this right hip the problem itself. As in other words, it's supposed to go like tilt to the side over here, backwards, and tilt this way, okay? But because that's a long-standing problem, okay, let's face it, how many people can actually walk in this kind of position?
Yeah.
It's very awkward. So as a safety relief valve, this fellow over here, it will snap deliberately, misalign out of position to try to realign your hip into correct alignment. In addition to, this segment over here is not just a one dimension or two dimensions. As in other words, it doesn't simply just move forward or tilt this way. No, it moves not only like a Mobius strip, but also if you pay attention on this, it also tilts this way as well. So we're constantly doing like this, okay? So therefore, when it's doing that, that's why we're throwing this off some interesting, weird factors here too, because even the pelvic brim, this is shorter and this is taller. I want to see these, it should be remarkably symmetrical. And this is also shorter and this is taller. So in other words, this hip over here, I'm expecting it should go backwards, but instead it went tilted forward and it tilted into this direction here, right? It's a little interesting. So the only way to do that kind of bizarre exam finding is that it got to be this fellow over here. But however, I want to let you know, once this fellow over here, once we adjust it and stabilize it after a couple weeks, I will not be surprised you start to say, hey, what's going on? Why is this right hip start to become a problem? Okay, as I didn't really have that problem before. Now it's becoming symptomatic. That's the reason why, because this is the old problem that's going to start showing up. Okay. And I wouldn't be surprised that we may need to take a re-x-ray a couple months down the road and the values will flip. So instead of this thing is tilting forward, I am expecting it should tilt backwards and also rotating externally as well. That's my expectation, okay? Right now it's not doing that because, like I said, it's this fellow over here. Now, as a result of this fella, the second sacral segment that's knocked out of alignment, your foundation, instead of moving like this, a subtle small movement, it's now moving too much on the bottom. Okay. And since there's too much movement, it's grinding this part away. That's what we're seeing this. This is degenerating. This is also degenerating. And this is a little swollen, and we're starting to get a normal discs over here. Okay. So therefore, after I adjust this one, I'm gonna double check that 5. We may need to adjust that one, 50-50, okay? What I am seeing is your 6th dorsal, this is the next fellow we need to address because you're tilted up this way, and that's what's causing this arc effect over here, correct. In addition to, right, your 3rd dorsal over here, I wanna see these ribs symmetrical, but this one is like, you see, it's like tilted this way. This 3rd dorsal over here is also, what it's doing is, it's rotating this way, and it's also side slipping. In other words, it's rotating so much, this bone over here is coming off the edge. And that's what I'm seeing what number 3 is doing over here. So this may help explain why it's like when you try to do that pull downs, it's blocking, right? And on top of all that fun, we also got even the 6th dorsal is also disturbing this rib over here and this rib over here, okay? Especially you see this is more pronounced over here, okay? So why is that a problem? Your scapula, okay? It needs to glide over your ribs nice and smooth. But because of all these bones that are twisting, okay, it's causing the rib to stick out like a speed bump. Not just one, you have several. So the scapula is not gliding properly. So when you're trying to do a lat pull down, it's like gliding over that and you're hitting that impact and it's aggravating that muscle over there, and then bam, it says, okay, that doesn't feel fun. Okay. Whereas some other angles, no problem. So we're gonna address that one. And on top of that, we also have that nice little posterior inferior misalignment of that fifth cervical over here, and it's degenerating a bit. And on top of all that fun, your atlas over here, it's rotated this way. So tracing down, that fifth cervical is also rotated towards the left. So when I correct this fifth cervical and bring it down this way, because right now it's upward this way. So once we bring it down this way, this, instead of being here, it's gonna calm down and center, recenter and re-level your atlas in your head as well. Okay, so that's what the battle plan is gonna be, this for the spine. A little more in.
Oh. Oof.
Okay, come on up. Walk around.
Oh. And I will feel that from the front. Usually they crack from the side.
This is a little special because we're more precise in where to realign it in the exact three-dimensional plane. Tell me, what's different?
I feel maybe a little more loose, like free. It's always, I feel a lot of pressure, not pain there, but I feel like maybe more free.
Good. So you just still fixated. It's not recompensating properly, so I need to adjust this one too. A little more, let it drop. There's the other one. Come on up.
Yeah, it feels a little less painful, that one.
Good. What are the changes you notice right now?
I just feel maybe a little more lighter. I'm not like stiff.
Good.
Yeah.
Good. All right, let's get the rest, shall we? Okay, come on up.
Yeah, that was needed.
Try the shoulders now. See how does it feel?
What to check?
Try the shoulders.
Shoulders, yeah. Yeah.
Do you notice anything different there?
I feel it like it's more free of the move, like not any restrictions. Yeah.
Nice. Let's get the rest. There it is, right there. So I'm just feeling for that nucleus pulposus, the liquid ball bearing right in there. And because it's a side slip, we're gonna take it this angle, lift it and right, there.
You want to walk?
Sure, you can walk.
Feel good?
Try the shoulders now again.
Yeah. Yeah, obviously, I can go much easier closer to my head, like, yeah, feel good. It was needed.
Okay. Now we're gonna check the fifth cervical. Right, that angle, got it. Relax. There it is. Now we're checking, double checking, see how that liquid ball bearing, I want to make sure it pivots all 360 degrees.
Oh yeah, feel more smooth, like.
It's right there, a small little piece. There it is. Okay, all right, stand up. Now try the shoulders again.
Yeah, felt good.
What's different about it?
But I don't feel any limitations, pressure, like usually I was feeling like a little bit tightness, what was limited my move, and I was need to push more, like this was like me more loose, more free. It's like how it's supposed to be.
Now before you were saying pain here.
Pain was there, yeah.
How's it now?
Yeah, less pain a lot.
Less pain, right?
Yeah.
Okay. You also complain about pain over here too. How's that?
It's good.
Much better, right?
Much better, yeah.
Yeah, see, your levator scapula is much more calmer. Okay, now let's check the shoulder itself. It's moving a lot better. Good. Okay, let's check everything else. See, stable,
Yeah.
unstable. There's a give over here. Okay. You have some swelling over here. Still, some edema. So you have a medial ulnar that's out on the proximal side. Okay, so we're gonna pump this up first before we set this bone back in place. Okay, get a little more in there. Just a little more. There it is. Okay, try the elbow.
Yeah, feel good.
Good. So the right hand, you were saying that you had trouble doing push-ups?
Yeah, trouble pressure. Yeah.
Yeah, can you try to do a push-up right now?
Yes. Yeah, I feel pressure like in this area when I'm.
Got it. Okay. Let's clear this up. Okay. Good, that's stable. Good, that's stable. Okay, so what I'm seeing here, there's supposed to be 2 rows here. Okay. The problem is this lunate is jammed this way. Okay. It's supposed to be like it says, like 2 rainbows. An arc here and an arc here. The problem is I see the lunate is jammed out this way. And also even your capitate is also jammed out as well. And it looks like you have an old fracture in there too, because that's what that little bone chip is in there too. All right. So, first things first, we're gonna get your lunate back in place. There's that fella. Now the capitate is a little tricky. Okay, because this is, I could tell this is chronic, it's been there for many, many years. This capitate problem, okay. So we're gonna pump this up first, get a little more motion in there. And then we're gonna sit it. Okay, no, face towards me, face towards me. Okay, just sit it. Just like that. Yeah, feel that difference. Okay, now we're gonna get your thumb. There's that fella. Okay, all right, give that a try, see how you like it. Good?
Yeah.
Go ahead, try it.
Yeah. Yeah, much better. I don't feel like pressured here in this area when I can even bend more. Good. I hope it will not return.
All right, next component. Let's take a look at the feet. So everything is all twisted up. This should be more straight, not like this. We got bunions on both sides. Oh, this is in trouble. Okay.
Better ball than one.
Yeah. So this piece broke off over here. Talus is misaligned. Cervical is misaligned. See, I don't want to see this. This should be parallel lines. See, this is like a V shape over here. So that's why I'm saying this talus is out. Okay. And your cuneiform is not happy either, because I also see it swollen over here. The cuboid dropped. First metatarsal dropped. Oh, that's fun. Okay. Huh. Your right one's also somewhat stored as well. You got a V shape over here. This is like over here when it should be here. So talus is out. Oh, your cuneiform is not too bad. Not too bad. Decent. The cuboid's out. Fifth metatarsal's out. Okay, we got work to do. Let's get to it. You weren't kidding. This is jamming up.
Yeah.
I could also hear the crepitus going on.
Voila.
See, it's clicking too much.
You know, it's like you tell 5-6 times like when I do circle, and one it's like a big, like literally blocking now.
Yeah, your talus is badly misaligned. Let's get to work. There's one fella. Oh, we're gonna do a little more on this one. This is chronic. Getting more in there. Okay, first tarsal. There's that fella. Oh, we're gonna rebuild his foot. Okay, we'll get there. Next one as well. There's that clunker. Okay. Okay. calcaneus slightly out. But what's more important is, feel that tendon right here?
Yep.
Yeah, that's your cuneiform. Second cuneiform's out. Cuboid's out too. It's not moving. So first things first, set this fella. There's that fella. Let's get this cuboid. There's that magic. Okay, now let's figure out what's going on with your left. And that's what I see on the X-ray as well. See, it's not that bad, right? But just slightly misaligned. Let's get your second cuneiform out. A little more. Good. Cuboid's out. Here's that clunker. Okay, see what happens when we start to restore the transverse arch? See, your hammer toes start going away. See how it's bunching up now? So when I restore the transverse arch, see how the toes, they start straightening out. Right? So that's what I'm saying, that the transverse arch, we've got to rebuild this whole entire foot just to get your toes in the proper alignment. Now, okay, we've got to work on this bunion over here. Oh, there's a piece. It already went. Pump this up. I'm going to pump the joint in. Okay. Now I'm going to set this. There's that fella. Okay. I'm going to set this bunion in as well. Good. Let's put this down. Let's set this over here. And a little more. There's that clunker. Okay, go ahead, walk around.
Feel good.
Tell me, what's different about them?
Usually, it was very difficult to put this to put pressure on these toes, on these feet. I was keeping the flat always, and then in the last moment I was bringing up. But now I can feel like I can finally use my feet to roll,
Toe off, right?
To have toe, yeah.
Yeah. And we could also see, take a look at your bunions. A lot more straighter out. Same thing with your hammer toe, see? It's not curling up as much.
Feel good?
Yeah. Anything else, my friend?
I think no. That's perfect. Now I can start to run again.
All right.
Thank you.
Oh, you're very welcome. Okay, have a great one.
Thank you.
So how's the feet, knees, hands, how's all that?
It's doing good, doing better. Yeah, doing
Great.
better. I'm starting to run. I didn't have any problems so far. I'm
good.
still a little stiff in the back, but that's some stuff like we speak about that exercise I need to do on my daily base to get stronger core, and like we see it was a lot of stuff didn't was in alignment, but that's something we need to work.
Hey, that's great. Okay, we'll keep at it. Thank you for the updates.
You're welcome.